Alrighty guys, we're back and we're going to look at another case study here. So we just learned that primary relationships are super important, especially to the adult patient. Now much of the time this primary relationship is with a spouse, but it can be with someone different if the individual does not have a spouse. And sometimes you need to realize that who you think would be the most supportive is actually not. So let's look at this case study and think through some things. So Mary Ogden is 52. She's a single teacher who is hospitalized for treatment related to diabetes. The small community where she lives, she has taught for 25 years, and the community adores her. Through the years, she's received numerous awards for community service. She's a cheerful person who, in spite of her illness, continues to be an inspiration to everyone. She's especially fond of Pam Carlisle, the head nurse on the unit where Mary is being treated. On the afternoon before Mary's planned to be discharged home, a visitor comes to the nursing desk insisting to speak to Pam about a highly personal matter. The visitor is Agnes Ogden, an elderly lady who informs Pam that she is the older sister and only living relative of Mary. The visitor seems sincere and asks that Pam provide details of her sister's condition so that she might be better prepared to help her with her illness and personal affairs. Pam complies with her request, actually feeling relieved that there is someone to share this burden with her. The following morning, Pam visits Mary's room and finds her very irate for the first time. The patient informs Pam that she's not been on speaking terms with her sister for many years, and that she considers her sister to be untrustworthy, and that she thoroughly resents her sister's having the knowledge of her personal illness and affairs. Mary feels betrayed and develops a distrust of Pam as her healthcare provider. She becomes depressed, agitated, and uncooperative. So this is an example of a nurse inside of a hospital, but the same can go for a medical assistant working with patients and losing trust. So let's think through this. What could Pam have done differently to foster Mary's trust? What do you think? Do you think she could have asked Mary if it was okay to speak to her sister Agnes before giving her any information? Yes, there's actually, you'll learn more about this in one of my other classes, but there is an act called HIPAA, and she is violating HIPAA by giving private personal health information to Agnes without her consent. So this is actually breaking the law and rules, but there was also trust that was broken, right? That trust between the provider and the patient. And even as a medical assistant, you want to ensure trust with your patients and you don't want to break that. So what would you have done when Agnes came to you requesting information? One, we could have asked Mary if it was okay to speak with her. We could have told Agnes that she needs to speak with Mary in person herself, because Mary is she's able to respond, and if she wants to share that information with her, then that's absolutely fine. In clinical practice, I have this issue or this kind of situation lots of times. If the patient is able to speak for themselves, I often refer family members to that patient for them to fill them in on what's going on, because again, we don't know a lot about that family dynamic, those primary relationships, and what's going on behind the scenes. So if the patient is able to be coherent enough and knows what's going on, it's important for them to be the one that shares that information. And if they prefer that you answer some of the more clinical questions, then that needs to come from the patient and to get their consent for that. So Pam has broken the trust that once existed between them. How might you rebuild this trust once it's broken? What are some things that she can do? Pam can certainly apologize, maybe explain to Mary that that's not necessarily, it wasn't her intention, that she didn't mean to make her upset or break any of that trust, or provide Agnes with any information that she didn't want to, that she was unaware of the situation. But being sincere and apologetic, not being defensive in this kind of situation would really be helpful. And understanding that Mary has every right to be upset and to feel a little angry about this situation. So kind of think through this case study and understand how those relationships and how those families still affect patient care is really important.